So I'm going to turn now to thinking about qualitative reviews, because that's the kind of focus of this talk. But when people have been thinking about the limitations in relation to equity that are being sort of highlighted in relation to quantitative reviews and their usefulness for decision making, one of the ways in which one of the main suggestions that people are making is, okay, well, we need to do qualitative reviews to add in greater insight into sort of context and understanding of social processes, social norms, why interventions may or may not be working, or to help explain the equity-related mechanisms of particular intervention strategies. So, the sort of one of the solutions is let's do more qualitative reviews to help add that context. And that is really valuable and really important. And as a qualitative researcher, I love that and welcome it. However, not all qualitative systematic reviews are done as part of an adjunct to or to enhance or explain intervention reviews. We have a lot of qualitative reviews that are being undertaken as important inquiries in their own right. And we can't sort of assume that those reviews are somehow value-free and, just because they're looking at experiences, that they are also thinking about equity, because that doesn't happen by itself unless we attend very consciously to thinking about what that might mean. So some qualitative reviews, even if they're undertaken as an inquiry in their own right, of course, have an equity-related focus and incorporate a lot of aspects of sensitivity to equity by looking at marginalized groups or doing intersectional analyses. A lot of qualitative reviews, however, are framed in a more generic or universal way. So they might be, for example, what were nurses' experiences of, working during the pandemic? Those kind of universal or generically framed reviews may well have a really important equity dimension to them. But unless we sort of think about how can we make that explicit, we may be missing important sort of aspects of people's experience and outcomes.